After living a miserable life for months and most often many years after this type of injury to your upper cervical spine, a whiplash injury, there's a simple path for you to take to restore your life to a relative pain-free existence, a focused existence, an existence where you can go back to work, enjoy your family, enjoy your friends, enjoy your education. And that is to contact my office. Upon contacting my office, you'll speak to my nurse practitioner, Pamela Perrin, who is a registered nurse practitioner and is an expert in this field. She will do a screening interview to make sure that you're an appropriate candidate to begin the process. Obviously, to understand something about your injury, to understand your symptoms, and to get a feel for what you've been through, the dozens of providers you might most likely have seen and have gained no benefit from, because they've offered you nothing of significance, or treatments that don't really last or don't really work. So after she defines that, she can find out from you whether the first step would be, do you want to have a Zoom conference, which lasts with me at least 2 hours, sometimes more, or come down to our office in the town of Oldsmar, Oldsmar, which is really a suburb of Tampa, Florida, and see me in person. The process would be the same in terms of our interview and our discussion. At that discussion, I would like you to have, ideally, a partner with you who knows you, who can add information to give us a well-rounded picture of what's wrong. Now, you need 2 diagnostic studies that have to be done. Sometimes they can be done in other parts of the United States, depending on where you are, or if in Europe, more likely you would have to come to the United States, because I'm not aware of any facilities in Europe that can do this type of issue, including even the Middle East and Asia. Be that as it may, the studies are a video of you moving your neck, and it's called a digital motion X-ray, and it's performed in an office, and an operator will have you move your neck in different directions and will film it over about a half an hour. And then we will be able to, by looking at it with you, determine which part of the cervical spine, and in this case it would be upper cervical spine likely, or maybe other parts as well, are injured and need to be fixed. Now, the other thing that we're going to have done is an upright MRI, where you're going to be sitting in an MRI and have your neck moved in different positions, which unfortunately hurt for the moment. But that's intentional, because we want to know where you hurt. Because by knowing where you hurt, we can know where in your cervical spine we need to give the attention to repair it. Now, after those procedures are done and we see them, we would then obviously, if you are interested in surgery, which we would explain in detail, see you in person, review the imaging studies in person, and most importantly, do a physical examination, whereby I do a very detailed general exam. I want to make sure your heart is functioning properly, your lungs, your abdominal systems, and then I want to look at your neurologic systems, and I go through a very detailed exam. It doesn't take very long, about 20 minutes. But in that period of time, I can, matching it to your symptoms, subjective symptoms, to what you report, and to your pictures, to the digital motion X-ray video and to the upright MRI, we can then put together a picture. At that point, we sit down, after looking at the imaging studies together for an extended period of time. I jokingly say that you can become a graduate neuroradiologist by the time I'm done with you. And we come up with a solution. And if the solution is surgical, I go through the process of explaining to you exactly what the surgery is, the potential risks, and the benefits, and our record. If necessary, we can even have you speak to another patient who has had surgery, if you are seriously interested in it. You can go home and think about it, and some patients right then and there decide, at which point we would schedule you. You do not have to wait months or years, you have to wait a few weeks. And we could schedule you to have surgery, either depending on your age and general health in the outpatient center, or in the hospital, in which you would not have a prolonged stay. You would stay 1 night, 2 at the most, and then proceed with your post-operative rehabilitation, which is very simple. You will not need, in all likelihood, physical therapy, further chiropractic treatments, further injections. You will simply be wearing a collar, and over a period of time get better, and within a few days resume your normal life. Within a few weeks resume your normal activities.